So baking soda, is it good? Is it bad? Should you keep taking it for acid reflux? A lot of people are taking this thinking it's good for them, and they don't really understand what they're doing. Baking soda is sodium bicarbonate. Now take a look at this. We got the stomach right here. The stomach normally should be not just slightly acid, extremely acid, between 1 and 3. That's normal. You need your stomach acids to be at that pH to digest proteins, to kill off microbes, and to absorb minerals. Okay? Now, as this food gets through the stomach, it goes into the small intestine right here, and the pancreas releases a bicarbonate. Now, remember what baking soda is. It's sodium bicarbonate, okay? So our bodies are supposed to have bicarbonates not in the stomach, but just past the stomach in the small intestine to neutralize the acid so it doesn't damage the small intestine. And also, the bile that comes out of the gallbladder, that's also alkaline to help neutralize this. So bicarbonates are alkaline. So what we're trying to do is we're trying to neutralize that acid. But if you're putting this baking soda, this sodium bicarbonate, at this level in the stomach, you are going to mess up your digestion down the road. Now, you're going to feel better temporarily because of the acid reflux. It's going to help neutralize it. But the next time you eat, it's going to be a little bit weaker and weaker and weaker and weaker because you're treating the symptom. You're not treating the cause of the problem. The question is, why is the stomach more acid? Why are you getting acid reflux in the first place? Normally what happens is the valve on top of the stomach is not shutting. So that acid is refluxing back up into the esophagus. It's also called GERD. And so why is that? It could be from either an autonomic nervous system problem because you're deficient in B1, or it could be you don't have enough stomach acid because that valve closes if you have enough stomach acid. And this is why people feel so much better when they start taking apple cider vinegar for problems like this, or they take betaine hydrochloride, which is an acidifier, and they can build up their hydrochloric acid. They feel so much better, and it's more corrective. Sometimes you might take 3, but in reality, you may need 5, 6, 7, 8, even up to 10 before a meal initially for it to work. Just from experience working with a lot of people over many years, I found that some people just need more, and then it works like a charm. And the problem is they don't know that, so they try it for a couple days. They take a couple, doesn't do anything, and then they give up. The key with that is taking more. There's some other things you can do as well, like the combination of zinc carnosine and betaine hydrochloride is very effective for acid reflux. Some of the long-term side effects that can occur if you're taking too much sodium bicarbonate over a period of time: vomiting, diarrhea, kidney damage, depressed breathing because your pH is altered, worsened cardiac heart failure. So if you already have pre-existing heart problems and you're taking baking soda that throws off the pH, it messes up the heart. Okay, and then we have cerebral hemorrhage, bleeding, and then we have a deficiency of calcium, which causes muscle spasms. And then we have a decrease in potassium, which leads to a whole cascade of bad things that can happen after that. You can get belching, bloating, but other than that, you're good. Hey, before you leave, I just wanted to give you a little quick history on some of the books that I wrote. This was one of the first books. It's called Dr. Berg Body Shapes. It was my attempt at writing about body types. What was very interesting about this book is I actually did all the images myself. Don't ask me why. They look actually not quite as professional as some of the images that I have in the new book. But anyway, this is my first attempt right here called Dr. Berg's Body Shape Diets. And then I wrote a book more extensive called The 7 Principles of Fat Burning. I don't even have a copy anymore, actually, because it's outdated. The next book, I put about 1,000 hours into this one right here called The New Body Type Guide. Major updates on the body types. I put a lot of energy into this. It has professional images, graphics, all sorts of things. Now, the problem with this book is it doesn't really describe what this is really about. Body types are only a small portion of what's in this book.
And that's why I changed the name to the Healthy Keto Plan, okay? If you happen to have this book, you don't really need this book because there's some only very, very minor updates. But if you don't have this, you need to get this one right here. This book goes into every single detail that you would ever want to know about. It goes into the 7 principles of fat burning. It goes into hormones, the body types, the basic keto plan. It goes into intermittent fasting. I talk about the 10 fat burning triggers and blockers and fat burning strategies with a lot of details in every single chapter. I go into body issues that interfere with losing weight. There's very few people that just have a weight problem. They have a lot of body issues, whether it's sleeping problems, stress problems, inflammation, menopause. I cover that extensively in this book. Then I talk about how to get rid of stress, and I show you a technique. Then I get into exercising. And then I have a lot of really good recipes in this book as well. So this is a good reference guide. On my website, if you get this book, you get this one free. It's called Healthy Keto Intermittent Fasting. This is the shortcut, quick guide to this book. And the reason I created this book is to have you, within 45 minutes, learn how to do keto, okay, in intermittent fasting, exactly what you need to do. Then you can fill in the blanks with this book right here. So right now I'm doing a special. If you get this book, you get this one totally free, or you can go to Amazon and get these individually. So I just want to clarify the difference between this book and this updated one right here. If you don't have this, you need to get this right here. That way you can get the exact correct information to do it healthily.